I'm Lisa Pickering, and welcome to CITV's Press Talk. Here's the most recent news and information from the government of Bermuda.
Good morning, all. You'll be aware of the recent outbreak of flu at the hospital and how it impacted the hospital and put a strain on their capacity. Difficult decisions had to be made to optimize available bed space. And what I'm going to do today is to use those difficult medical decisions as an analogy regarding the Ministry of Health and Seniors budget and the impact. Because of our country's debt and the burden of servicing that debt, we've had to be very disciplined in allocating funds. Just like the professionals at KEMH in the face of the flu outbreak, we've had some difficult decisions to make with respect to what can we do for the people of our island. As at April 1st, the ministry's budget will be cut by 13%, or $23.6 million. In fact, for the first time ever, paying down the country's debt has become the most expensive item in the budget, with health and seniors the second largest spend. I used to be able to say that we were the largest, not that it was a feeling of pride, but for the fact that that was the reality. But now we're the second largest. The 13% will have the most impact on the grant and patient subsidies historically paid to the Bermuda Hospitals Board. BHB is a quango established under the Bermuda Hospitals Board Act 1970 and is under the purview of the Ministry of Health and Seniors. Thanks to continued modernization, cost-cutting and other efficiencies, as well as reserves that can tide them over, we will be able to manage this reduction. I'm encouraged by their hard work to bring greater efficiencies in the delivery of health care. Make no mistake, the cost of health care in Bermuda is high. In fact, Bermuda's per capita care cost ranks highest in the developed world, second only to the United States. We've been working to curb these costs everywhere we can. The National Health Accounts Report 2016 shows that Bermuda started to bend the curve in 2011, and we are now seeing sustained reductions in total health expenditure. The latest report shows a 1% decrease in total health spending since 2015. We are working to ensure this reduction translates into lower premiums for the population, and we count on the support of private health insurers to reflect similar trends when premiums are adjusted over the next couple of months. Healthcare providers are the lifeblood of any health system. Strong collaboration between public and private healthcare providers and economies found by working together cooperatively will enable us to reduce costs while sustaining quality. The ministry continues to collaborate with stakeholders to right-size KEMH. The hospital's primary role is to provide care for people who are seriously ill or injured. In addition, it provides a host of essential services for the community, including provision of diagnostic testing for private independent physicians. This is an important source of revenue, and this year we will be bringing the hospital's diagnostic imaging fees in line with other testing facilities on the island. The other issue being addressed is long-term care capacity concerns. The scope of long-term care is very broad, as it includes seniors as well as disabled persons. As we've seen, the country's acute care capacity is being impacted by changing demographics. And I have to restate the call that I made before for the whole community to rally together to take care of our elders. Now is our turn to give back to the generation and provide the loving attention and care that will keep them well and at home. Our one acute care hospital is not meant to be used for housing. The recent flu outbreak reminded us that beds are needed for the acutely ill, rather than for persons who could safely be cared for at home, or at home by their families, or in another appropriate care situation. But just remember, long-term care is not just about institutions, beds, and bricks and mortar. It's just as much about skills, capacity, and social support systems that enable those affected to have good quality of life. Now that's why long-term care is a priority for the ministry, and we're working through our action plan to address concerns with education and capacity building. I will keep the public informed as we make progress in these areas. As Minister of Health and Seniors, I spend a great deal of time considering the cost to the country of unhealthy residents. We want you to be healthy and happy so that you can enjoy life, but for another incredibly important reason, to manage the cost of health care. The ministry continues to work on healthcare reforms through our Bermuda Health Strategy and Action Plan. These reforms aim to improve quality, access, and sustainability through essential measures like controlling chronic non-communicable diseases. We all have a part to play because each one of us with a preventable chronic condition like diabetes or hypertension contributes to increased cost. Making healthy choices and seeing your doctor to manage these conditions better means a better quality of life and lower health care cost. The ministry partners with many non-governmental agencies that promote better health, and I encourage everyone to take advantage of their phenomenal expertise. Primary care physicians should be at the top of your list when you're looking for non-emergency care rather than the emergency room. Remember, the cost savings that you generate by living a healthy lifestyle and making appropriate choices enables us to deal with the gaps and deficiencies in the healthcare system. After all, it's the only system that we have, and we want it to function in the best way possible. I can't stress enough how important a good health care is. Good health is to contain healthcare premiums. And I have to say that again, good health helps us contain healthcare premiums. If we're in good health, we need less treatment, which means fewer costs and lower premiums. For this reason, my ministry takes very seriously the expression, actions speak louder than words. We're developing and implementing initiatives to address chronic non-communicable diseases in particular in order to help those afflicted and reduce costs. Our Enhanced Care Pilot Program provides chronic disease management and medication for persons with conditions like diabetes, hypertension, and asthma. Better management of these conditions in primary care settings will result in less hospitalization and better health outcome for these patients. We're working to put in place a chronic disease register to better track and manage persons with these conditions. BHB has put in place its patient-centered medical home to assist underinsured persons in need of chronic disease case management and control. We are looking at more ways to have kidney transplants so that expensive dialysis costs can be curtailed. In addition, we've also introduced the health insurance benefit through HIP and Future Care to assist families in caring for loved ones at home, which reduces the need for hospitalization. We continue to look at ways in which we can regulate health care in order to improve the quality and safety for our population. As you can see, we're about making meaningful change, and we're trying a range of measures to tackle the challenges head on. I believe we're making progress, and I believe the National Health Accounts Report demonstrates that the combined efforts are starting to bear fruit. We will continue to use the funds available to our ministry to inform, educate, and empower people about health issues, especially amongst the most vulnerable populations. I would like to thank everyone who has helped Bermuda bend the healthcare cost curve. It has been achieved through sacrifice, and we must all be proud of what we've accomplished. We're not out of the woods yet, and we must continue to improve our health behaviors and use healthcare services appropriately to keep the cost coming down. Finally, I want to thank everyone in healthcare for working hard to help us all be well. I want to call on all Bermuda to make healthy lifestyle choices and good healthcare choices. Without individual change, we will not unlock the significant investment we're making in health. Healthy people are productive people. With everyone working together, the vision of the Bermuda Health Strategy will become a reality. Healthy people in healthy communities. Thank you very much.
Questions, anyone?
Minister, you seem to be taking our hospital system to what we call the A&E style system, where it's acute and emergency. Is that going to affect in any way the overseas use now we've been making, for example, non-elective surgery? Is that going to change? Are you going to try and get that to go back overseas again?
No, because what I am going to try and do is to make sure that the hospital manages its role in affordable care. Because if you stop and think about it, you don't. If we can do it on island at a cost-effective basis, it's good to do that. The reason being is that people do not have to go off the island. They also are able to stay in contact with their primary care physicians. They're here, but I have said to the hospital, I need you to come and look at what clinical affiliations that you have, because we need to understand that if you know the clinical affiliations, we will keep doing what we can on the island, and what we can't do, we will have it go off the island, but we will manage it in a way. I want Bermudians, when they go off the island, to maintain their contact with their primary physicians, because you should just go away, get better, and come back, because that's not the end of your life cycle, your health cycle. You need to then keep doing whatever your physician said abroad, what other things you need to do in terms of changing your lifestyle. So I'm not about saying automatically go off the island, more on the island if it's sustainable and appropriate, off the island, but keeping the attachment to the primary system here.
So there's no change in that facility in Bermuda?
No, but what we are remembering that the hospital was supposed to be an acute care facility, and it does other things, and that's why I'm reminding the population that it provides services for independent physicians on the island, and some of those services will have to be provided because they just can't. So things like lab tests and x-rays and all the other things are an appropriate adjunct to the services that any hospital offers.
And the future care concept, where you're allowing people to have home care for their aged, how does that work?
Well, we recognize that many times staying at home is the best care. Not only are you at home, but also you're around your surroundings. But if you have the appropriate caregiver, it actually is more cost effective. So when Future Care started, it was to say, as many people as you can stay at home, and you don't get them going to the hospital where their care puts a strain on the acute care system, then it's more important. So we're monitoring that. And the other thing that we're doing, which I'm going to make sure in my budget speech I reinforce, is the fact that we are trying to get physicians to engage in what I call the primary care management of their patients. Because if you're seeing your doctor and he's telling you what you need to do to change your lifestyle to make your condition improve, then that's cheaper than turning around, letting it get out of control, and ending up in the hospital because now it's full blown and you have to stay there longer and we have to get you back. So we're continuing all of these levers we're trying to pull to make sure that the appropriate care is rendered at the first levels.
One thing I didn't hear mentioned during your presentation was mental health. Can you tell me what government is doing to try and address the issue of mental health problems on the island?
Yes, well, we thought about this office. I didn't want to end up adding everything, but that you'll see more of that into the budget speech. But obviously, the MWI is part of the BHB, and the BHB is working with us to address issues with respect to forensic mental health and how we can go and have a long-term solution to make sure that the persons on the island that have mental illnesses, that we're going to make sure that they're appropriately addressed. And we recognize that there are more and more people that are being afflicted by mental illnesses for a range of reasons. And so we have a short-term goal and a long-term goal to manage that and make sure that appropriate care is available. And the MWI is obviously the place that we start off, because that facility is geared up to deal with that.
This is a slightly different question. In other countries, they have been considering and implementing a change when it comes to organ donation policies, in which instead of the default answer being, no, I'm not an organ donor, the default is, yes, I am an organ donor, and people actually would apply to be removed from that list if they wish to. The theory being that it would help save lives and reduce, by making more organs available for people, so people who are on dialysis waiting for a list aren't on dialysis as long. Is this something the government has considered?
I know over time we've considered many things with respect to organ donors as well as transplants, etc. I am not aware of the most recent consideration, because obviously when we turned and we talked about increasing the costs for transplants, it was all along the line in terms of saying, if you can pay for your transplant, then we have a greater opportunity of being able to, if you will, put some money in the bank abroad when we have donors here that have contributed to the system abroad, and therefore we have something that we can go through, if you will, capital to turn around and say, well, we've donated these organs, what's the opportunity for our persons on the island to be able to get that now? Obviously it raises all sorts of issues about the public's right, a person's right to be able to make decisions. And so I can't tell you right now, but by the time I get to my budget speech, I will see whether I can incorporate that.
You've been watching Press Talk right here on CITV. Join us next time for your government's news and information. I'm Lisa Pickering.